There's a very small literature out there looking at how cannabis might affect, for example, cognition in MS. And usually those studies had cognitive variables as secondary outcomes. So the study looked at something else, and then they, in a cursory way, perhaps looked at cognition. Here we went after cognition in a more substantial way. So it's a more focused study and has the benefit of that. One of the hallmarks of cognitive dysfunction in MS is that they have what we term delayed information processing speed. They think slower. They take longer to solve problems. So just as a neurological disease slows you down in terms of your walking, for example, it can also slow you down in terms of your thinking and your intellect. Then what cannabis seems to do is aggravate that process, worsen it. So you're already starting off with a compromised cognition, and along comes cannabis and tends to worsen it. So when you have a look at a test of information processing speed, the cannabis smokers do even more poorly on it. Their cognition slows down even further. It also shows that perhaps the working memory, that aspect of memory that we use to keep facts online, that we're using all the time in our day-to-day functioning, that might be impaired as well by cannabis use. People use it for many, many reasons, and I think just going into society in general, people use cannabis for many reasons. There's all sorts of reasons. I think we listed what they were individually in the paper, but some people use it just for recreational use. Others find that it helps them sleep, or it might reduce their anxiety. Some report that it might help some of their physical symptoms, such as pain or spasticity. So there are multiple reasons why they use it. From a mental health point of view, it's very bad to use cannabis to help you sleep, for example, or to help your anxiety or help your depression, because you can manage those difficulties in a much more therapeutic way. And that's always my message to my patients, that if you're using it because you're anxious or depressed, don't. We'll manage your anxiety and depression with therapeutic agents that will have less side effects and would be less harmful. Well, just to give a little bit more background, about 40% of MS patients living in the community will have cognitive dysfunction. That's a well-replicated finding. What we showed is that if they smoke cannabis, this is smoked cannabis, not prescribed cannabis, but smoked cannabis, street cannabis. If they'd smoked cannabis within the past month, then that group had greater cognitive deficits. In particular, their thinking slowed down more, their speed of information processing was more impaired, and they had some deficits in working memory that were accentuated by the cannabis. Now, having said that, the sample size was 10 subjects. So it's a small sample size. And they were compared to a control group, well-matched, tightly matched, of 40 MS patients who had not smoked cannabis. So the control group was a fairly robust group. The cannabis numbers are small. So these findings are preliminary but of interest. Because I don't think you can apply this result to the prescribed cannabis. I mean, obviously they're similar in terms of cannabinoid derivatives, but this is different. This is different. We're talking here about smoked cannabis, illegal cannabis, not even cannabis grown by the government of Canada, which they have done in the past. We're talking about patients who scored a joint on the street corner from somewhere. So that's where the data are most applicable. So you cannot, I think, extrapolate from this to the prescribed cannabis that neurologists use to treat patients with spasticity or pain. Having said that, I think it's a potential warning factor to these neurologists that there may be some of these side effects associated with the prescribed medication as well. We just don't know. We need to get out and do the studies. And a useful way for us to go now, I think, and we want to do this here at Sunnybrook, is to compare the smoked cannabis to the prescribed cannabis, the medically prescribed cannabis, to no cannabis. Undertake a three-way comparison and see whether we can tease out these findings a little further. I think that clinically that's going to be a very important question, and it's a study waiting to be done, and we hope to do it. Well, even before we did the study, my advice to my MS patients was not to use street cannabis. I think it's just not good. I think there's quite a strong database out there, not MS related, that street cannabis is bad for your mental health. So I certainly did not advocate, I never have to my patients, just the opposite. And I know that a number of them do use it for all sorts of reasons. And I've always said don't use it. Now I have a little bit of cognitive information that basically supports my earlier advice, which is that potentially smoking street cannabis might aggravate or worsen what cognitive deficits you've got. I can't say that with absolute certainty because we come back to the fact that this is based on 10 patients, but there's a little bit of information here to suggest don't do it. Right, so the next step is, I think, to build on this data. This is preliminary data, very interesting data. We want to go and do a more detailed study, increasing our sample size, then looking at cannabis smokers versus people who have prescribed cannabis, comparing to MS patients who don't use cannabis at all. So to do a three-way comparison to see whether we can tease out in greater detail this relationship. And we're going to do this quite soon at Sunnybrook. Patients ask all the time about cannabis, and they want medical opinion on the drug. And right now we've been relying more on anecdote to inform our opinion than on fact. So it's very important that we have the facts to give back to patients. And this is some preliminary data that allow us to address the question. But we need to do it in a more substantial way. There's a great clinical need to answer this question.